Cancer-related fatigue is one of the most common things people experience during treatment. And one of the hardest parts is that it often doesn't improve with rest. You might sleep 8 or 9 hours and still wake up exhausted. You might cancel plans, take naps, and scale everything back, and still feel like you're running on empty. If that's where you are right now, I want to be clear about something. This is real. It's not laziness. It's not in your head. And it's not something you're doing wrong. This kind of fatigue is different. And understanding why it happens and what can help can make a real difference. Most of us are used to normal tiredness, the kind you feel after a long day or a bad night of sleep. That usually improves with rest. Cancer-related fatigue doesn't work that way. It's deeper. It affects your whole body. Even small tasks can feel overwhelming. And sleeping more often doesn't fix it. That's because this fatigue isn't just about being tired. It's your body responding to treatment, inflammation, and a lot of internal changes happening at the same time. Fatigue during cancer treatment almost always has more than one cause. Treatment itself plays a role. Chemotherapy, radiation, and immunotherapy can all affect energy, sometimes directly, sometimes by affecting blood counts or metabolism. Inflammation is another piece. Cancer and many treatments trigger inflammatory responses that can leave you feeling worn down in a way that's hard to describe. Anemia is common during treatment. When red blood cell levels drop, less oxygen reaches your tissues. That can lead to fatigue, shortness of breath, or lightheadedness. Nutrition can change too. Appetite shifts, nausea, and taste changes can make it harder to get the fuel your body needs. Even mild dehydration can make fatigue feel worse. Sleep is often disrupted. Trouble falling asleep, staying asleep, or getting truly restorative rest is common, whether from medications, discomfort, anxiety, or changes in routine. And there's the mental and emotional load. Appointments, decisions, uncertainty. All of that takes energy. Cognitive fatigue can add up. Often, several of these are happening at once. That's why fatigue can feel so persistent. Some contributors are medical. If anemia is part of the picture, your team may address that. If a medication is worsening fatigue, timing or dosing can sometimes be adjusted. If sleep disruption is severe, that's worth discussing. Some of it is about how you move through your day. Activity and rest aren't opposites. They work together. Gentle movement, even briefly, can help over time. But pacing matters. Doing too much one day and crashing the next often makes fatigue worse. Sleep routines can help, not rigid schedules but supportive patterns. Consistent bedtimes, fewer screens at night, a cool, dark room, small signals that help your body settle. Nutrition and hydration don't have to be perfect, but they do play a role. Small amounts throughout the day. Regular fluids. Foods that feel manageable. So what tends to help? Small changes. Not overhauls, not perfection. Pacing your day. Resting before you're completely depleted, not only after. Resting in different ways. Sometimes lying down helps. Sometimes sitting outside helps. Sometimes distraction helps more than a nap. There isn't one right way. Letting people help. Accepting a ride. Letting someone bring a meal. Asking questions. You don't have to handle this alone. There are times when fatigue needs to be reassessed. If fatigue is getting worse or feels noticeably different than it has before, that's a reason to reach out to your care team. If you're feeling dizzy, unusually short of breath, or notice your heart racing with very little activity, those are important symptoms to mention. And if fatigue is making it hard to care for yourself or stay safe day to day, that's something your team should know about. Cancer-related fatigue is common during treatment. For many people, it's one of the most difficult symptoms to manage. But it's also something that often improves with the right support. Not overnight, and not all at once, but gradually. You don't have to sort this out on your own. Your care team can help you look at what's contributing and decide which adjustments are worth trying.